Good afternoon, everyone. Thank you for coming out, and it's great to be back in Broome County. First of all, with our amazing county executive, Jason Gardner, who I've spoken to many times as we've worked our way through this pandemic, the early months, the little lull time, and now through the fall, and now this winter surge. He's been a tremendous partner of ours. And we had a great conversation a short time ago. He told me he needed another site for testing and vaccinations in Broome County. And here we are, literally just opened a few days ago. There is tremendous demand for this, and it's set up in a way which is really smart, which is to use the same facility with our National Guard and our Department of Health and our Department of Homeland Security team all coming together here. But 3 days a week it's available for testing, which is what we're doing here today, PCR tests, as well as the other 3 days a week, Monday, Wednesday, and Friday that we're having, or Tuesday, Wednesday, Thursday, Saturday, but we have the vaccinations here as well. So I just want to make sure the community is aware of that. I also want to thank another tremendous partner of mine and longtime friend, our Assembly Member Donna Lepardo, who's been a tremendous champion of this region and is working very closely with us, and so I thank them. Also, our incident commander is here, Tim Dewey, who's worked very hard from the Department of Health to get this set up, get it operational, and for that we are grateful, as well as Stephanie Chapin, our Regional Emergency Coordinator from DISHES. Again, we have a brand new team in place in Albany, new leadership in all these agencies, and so I want to thank everybody for stepping up and doing everything they can. But I'm mostly here to help, to support the workers. I've been visiting various hospitals today, making sure that we let people know how much we appreciate what our hospital personnel have been going through, but also at these sites to just say we are unbelievably grateful to all of you, especially people from the National Guard who thought the early months of 2020, then through 2020 and 2021, at some point there'd be an end to having to be deployed to provide this life-saving assistance, whether it's the vaccines or testing, but they're here. They are always here where they're needed, and we want to give a special shout out to the National Guard and Major Ray Shields as well. I want to also deliver a message. We had a conversation about masks and enforcement of our statewide requirement that businesses enforce that there be either a mask worn or else a vaccination required before there's entry. And just having some casual conversations, and what I saw over in Tioga County when I met with the Martha Sauerbrey over there, it's not that big a deal. I have seen widespread compliance. Assembly Member, the County Executive Bosine, widespread compliance on a call with hundreds of businesses. This is not that big a deal to them. They understand that we are in unprecedented times, that we have to fact that there was this new variant, which even if you're vaccinated or boosted in some cases, you still can be vulnerable to contracting the virus. Now, number one, I want to let everybody know that there is not evidence, if you're boosted and have been vaccinated, that there's a severe impact to this. So the people who are severely impacted are the ones who are not vaccinated. They're the ones now filling up the hospitals, and those are the ones we're really asking to change their views and take advantage of a site like this, which is so easy to get to, and just literally walk in and you're taken care of. But also, just those who are questioning whether or not a mask mandate is necessary, yes, it is. We foresaw this when we watched what was happening all the way from South Africa to England. We saw how quickly this virus spread, this new variant. And that's why we put in place a requirement, a simple one, that you wear a mask because you can spread this even if you're vaccinated. And I ask everyone, please think about the most vulnerable person at your dinner table for Christmas dinner just in a couple of days. How would you feel if it turned out that you spread the virus and as a result they became sick, ended up being hospitalized, or worse, they did not survive the experience? We don't want that to happen, and that is why I'm just reminding everybody that masks are so simple, easily to be worn. There's very nice styles. I have this lovely We Are New York version here, but there's no shortages. We just ordered another 150 masks online, about $15 from Amazon. They're available. So I want to thank the businesses, first of all, who are complying. I just stopped at the Blue Dolphin Diner over in Tioga. Everybody was following the rules, and you know what? They still looked happy. And they were happy for one reason. They're back out together. Because we're doing the right thing, we don't have to talk about shutdowns or to keep our kids out of school or paralyzing the economy as happened last time when we didn't have the defenses we have right now, which are masks and vaccines and boosters and lots of testing. So it's a different world from what we experienced just 1 year ago. And I remind everyone that. And again, my gratitude to the thousands of individuals and the countless businesses and leaders who are stepping up and doing the right thing, because the numbers continue to go up. Our numbers in this county, even with all the great efforts we're doing, they're still going up, but they would have been going up higher if we weren't enforcing some of these requirements and asking people to get vaccinated. So we're looking at cases per 100,000 here in Broome County. It is up to 111. There was a time when we got nervous when it was 7, 8, 9, or 10 per 100,000. We're at 111 right now. And we know with the way this virus is spreading so quickly that those numbers are going to increase. And hospital capacity, which is what I've been focused on for months now, is going to continue to be taxed, and we're doing everything we can to help our local health partners as well get through this. So I do want to wish everyone happy holidays and a Merry Christmas, and my wish for all of you is that instead of spreading COVID, we spread Christmas cheer and make sure that we give the love and the chance to thank each other for doing the smart things so we can gather safely and get through this pandemic together. We are New Yorkers. We are New Yorkers. We're tough and resilient, and we will get through this. So at this point, I'll take any questions. Well, a couple of things. The majority of counties are doing the right thing. And what I talked about with Martha Saubre, who is the head of the Association of Counties, and I talked about this when I was in Wyoming County this morning. I talked about it with the county executive here. We have resources from the state to give to the counties to assist them with enforcement, and that money will be flowing immediately. Because what I've seen is there's a lot of people wanting to do the right thing, and whether it's just getting out there and bringing masks to the businesses and putting up the signs and having a call center, people can call in complaints, or sending a notice and a phone call, just to have the resources to do the right thing, to let people know that we're serious about this. In the counties that are cooperating and doing this, we're going to give them the resources they need to get it done, so you can count on that. But the state will be involved as well. We'll be sending around inspectors to do spot checks to see what's going on. We've always said we're going to leave it up to the counties, and we're going to be making sure that it gets done from the counties, but we also want to lend support to them as well.
For the past 2 weeks, as you started taking some action to address hospital capacity, have you seen that problem start to level off? Is it still getting worse? Where are we at statewide hospital capacity?
We're more stable than we would have been if we had not taken these steps. And what we're talking about is that hospitals where there's less than 10% bed capacity, we suspended temporarily elective surgeries to free up, not the beds, but to free up the workers. That's there's plenty of beds. It's the staffing that's been a problem. We also have had to bring in the National Guard to supplement some of our facility. I'll be in Buffalo probably on Wednesday again to talk about what we're doing there at one of our hospitals there. And our nursing homes have been taking advantage of our offer of help there as well. Also having EMTs available to help. So we have deployed individuals as well as adding more state contracts out there for people to hire temporary staffing. We've been in constant contact lining up temporary staffers around the country that hospitals can take advantage of so they're on the state procurement list. So we've tried to hit it from all the angles. And I watch those numbers all the time. At one time, we had 32 hospitals that were on the endangered list, not endangered species, endangered list. Now we're down to about 28. A number had come off, but a number went back on. And so all those hospitals in that danger zone are in constant communication with us because that is my biggest fear. And let me explain when people say, well, this variant isn't as dangerous. If you look at the transmission rate, the rate of transmission for people who have Delta variant, transmits at 1 to about 1.5 individuals over a 10-day period. There's a certain number of people, and you can probably estimate that about 2,000 people would end up in the hospital with 10% hospitalization rate. Over here at Omicron, only 1% hospitalization rate, but in that same amount of time where you'd have several thousand infected with Delta, you would have 1.3 million infected. So figure out 1% of that. 10% would be disastrous. Even 1% of that is high. So that's what we have to get people to focus on. As this spreads, and I don't think upstate New York has seen the full brunt of this yet, how fast it spreads. It's all over New York City right now. That's the hospital capacity I'm worried about. I believe that most people will feel symptoms. They'll stay home or they'll be asymptomatic, and we're focused very much on getting testing kits out. We just had another 1 million arrive. We're having testing kits set to all of our counties, including the smaller counties who don't have the resources to buy them. So it's getting testing kits available. We're setting up a portal so people can order test kits. And so if you have symptoms, test yourself. And if you are testing positive, please stay home. Don't go to work. Just self-resolve. You're going to be fine. If you were vaccinated and boosted, you're going to be okay. If you are not vaccinated, watch your symptoms closely because you are in a high area of vulnerability and could end up very sick in a short time. As I mentioned, we're getting millions of test kits out. They've been deployed to the local health departments. Many businesses have them as well. Some of them, in some areas they're on the shelves in pharmacies, some areas are not. We're doing a survey of all the pharmacies. I would say if anyone can get a test before you sit down with your family, absolutely do it. Because you may be boosted, but you could be unknowingly carrying that virus to someone at your table who is not vaccinated at all, or even just vaccinated and not boosted, and that's a vulnerability. So if it can be done, we highly, highly encourage it for sure. All right, I've got to run. Well, hospital staff have been doing the right thing from the beginning. I just left the hospital in the last couple hours. They're all wearing masks. It's not breaking through in any numbers that I'm aware of when you're wearing the mask anyhow. That's why we keep talking about the masks. It's simple. It's the easiest thing you can do. It's always been there for us. And there was a time when there was a shortage of masks, and we were scouring the earth and spending an inordinate amount of money just to acquire masks from China. They're being made here in America. You can get them. We have plenty, and that's why I'm going to be helping the counties that have said they'll help us enforce these smart public safety rules, and we'll give them the money they need to buy masks for all their businesses and make it so much easier. But I do have to run. I want to thank everybody for coming out today. I appreciate helping get the word out. So. It's something that we're working on with our environmental team, but also making sure that we don't miss an opportunity to create a new industry here in New York State. So we got to strike the right balance. We're working on it. Thank you.